In 2018, data shows that every day 128 people in the United States die after overdosing on opioids. The misuse of and addiction to opioids, such as prescription pain relievers, heroin, and synthetic opioids, such as fentanyl, is a serious national crisis that affects every public health, as well as social and economic welfare.
The Centers of Disease Control and Prevention estimated that the total economic burden of prescription opioid misuse alone in the United States is $78.5 billion a year, including the cost of health care, loss of productivity, addiction treatments, and criminal justice involvement.
In the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates. This subsequently led to widespread diversion and misuse of these medications before it became clear that these medications could be indeed highly addictive. Opioid overdose rates began to increase.
What is an opioid? Prescription narcotics is a category commonly prescribed by painkillers. Doctors prescribe them, typically in pill form, to help patients to serve acute or chronic pain when they are taken as directed by a medical professional. They are relatively safe and can be beneficial, but they are always at risk of addiction. That risk can increase greatly when you abuse prescription painkillers.
Recently, the greatest increase in drug-related deaths is due to the misuse of prescription drugs. But don't think you and your friends get a pass because you're young. In 2016, in Arkansas, the prescription painkiller death rate for those under 55 was nearly 5 times higher than it was in 2001.
Be on the lookout for more than 250 drug take-back boxes all throughout the state. The closest one to us is located at the Beebe Police Department. If you have any unused prescription painkillers sitting in your cabinets, get rid of them. It could save you a lifetime of pain or your life itself.
If someone offers you pills that weren't prescribed to you, say no. Encourage that person to dispose of them properly.
Never offer your own oh my gosh!
I don't even know what to read. I can't even read.
Never offer your own prescription painkillers to someone. Be sure to lock them up and store them safely out of reach of others.
If you find prescription painkillers at home, leave them alone. Better yet, ask the person whose name is on the label to lock them up or dispose of them if they're no longer needed or expired.
Warn your friends about the dangers of abusing prescription painkillers, including the fact that 4 out of 5 heroin addicts start by abusing painkillers. Drugs, you